Hello, learners. Now let's have a revision of what we have already studied about ADHD. Attention Deficit Hyperactivity Disorder, or ADHD, is a condition that affects an individual's behavior. Persons with ADHD can seem restless all the time. They may have challenges in concentrating, and they always act on impulse. Symptoms of ADHD tend to be noticed at an early age and may become more noticeable when a child's circumstances change, such as when they start school. Most cases are diagnosed when children are 6 to 12 years old. Although the symptoms of ADHD normally improve with age, many adults who are diagnosed with this condition as a child continue to have issues. People with ADHD may also have additional problems such as sleep and anxiety disorders, getting or asking for help. Many kids go through periods of restlessness or inattention. This is quite common though, and does not always imply that they have ADHD. However, if you believe your child's behavior differs from that of other children of their age, you should discuss your concerns with the developmental pediatrician. Or maybe as a teacher, if you notice a different behavior in a particular child in your class, you may talk to their parents. Now, what causes attention deficit hyperactivity disorder? Although the specific cause of ADHD is uncertain, it has been observed that the condition often runs in families. Research has also identified a number of possible differences in the brains of people with ADHD when compared with others without the condition. ADHD can occur in people of any intellectual ability, but it's more common in people with learning difficulties. ADHD comes under neurodiversity and it's not a disease. Therefore, there is no cure for ADHD. The challenges can be reduced to a certain extent with the right educational help, advice, and support. Adults with ADHD are often prescribed with medication, while psychological therapies such as cognitive behavioral therapy, CBT, is also used. I agree it can be difficult to care for a child with ADHD, but it's crucial to remember that they are unable to control their behavior. Some issues that may arise in day-to-day life include getting the child to sleep at night, getting them ready for school on time, making them listening to and carrying out instructions, making them be organized. It is really difficult for them to behave as per the rules set by the society in social occasions. Shopping can also be very challenging. Adults with ADHD may experience comparable issues, and some may experience difficulties with relationships or social interaction. It is really understandable that emotional self-regulation can be a task for a parent, carer, or a teacher who is dealing with a person with ADHD on a day-to-day basis. It is extremely important to learn some calming down techniques that the ADHD person and their parent, caregiver, or teacher all can practice to keep their calm. I will now request Ms. Therese Boscher to help us with one of those techniques.
What we're going to talk about right now is a science-backed technique that you can use anytime, any day, anywhere, and it is called the quick coherence technique. And what we do is we focus on the heart. And you teach the child this by saying, as I had mentioned before, you can put your hand on your heart, or you can just breathe into your heart. So now you imagine that your thought is to your heart. It's not in your brain where these looping thoughts are saying, I'm not good enough, nobody's listening to me. We're taking that out and we're breathing slowly to the count of 5 into the heart. And you keep this up in a slow, focused breath, breathing in to the count of 5 and out to the count of 5. And as you do this, then you think of a positive or renewing feeling. And you can help your child do this. I mean, we have studies that show that a mother holding a child, the heart and brain connection is so strong and it can actually be measured. So we do, as teachers and caregivers and parents, we have that ability to calm down an emotion that's out of whack. And this is just one of the techniques. And I would suggest you practice it before, because you want to not try to do this when there's screaming and yelling going on. It doesn't work that way. But as you do this and practice it when there's no emotional charge, you can calm down yourself so that the child calms down as well.